For a dialysis patient, his access is important. It's his lifeline. The best access a dialysis patient can have is an AV fistula. Whenever we have to decide on an AV fistula or a dialysis access, usually the patients are first screened. Using an ultrasound, we determine the sizes of your vessels. If they're appropriate for creating a fistula, for the ellipsis fistula, obviously the focus is a lot on the upper arm veins and the anatomy around your elbow region. The ellipsis procedure, it captures a part of your vein and an artery. It brings it together. You create the connection between the artery and vein, which then forms the fistula. That's the whole procedure. It's done within 40 minutes, and the patient goes home with a band-aid, and he can get back to his usual life. The ellipsis creates an AV fistula with 80 to 85% success rate. Majority of the patients who had the ellipsis fistula have started dialysis within 2 months of getting the fistula. Patients are very happy at the dialysis access. They're very happy they don't have the big swellings in their arm, and they're glad that they don't have a scar on their arm.
Yeah, I work in IT as a technical analyst, but I have higher aspirations. I'm in the master's program, and that's for cybersecurity with a focus in network and infrastructure. Well, I've been on dialysis for 7 years now. I initially started off with peritoneal dialysis because it was more conducive to my lifestyle, but I started to get a few infections, and eventually it progressed enough where it hospitalized me for 2 months, and I found myself on hemodialysis. The Ellipsys procedure has been a lifesaver for me. It's a much more efficient form of dialysis versus the catheter that I'm currently on. So it's a win-win for me. I grew up swimming competitively from the age of 5 all the way through college. I can't swim anymore because with the catheter, you're not even supposed to be submerged in water at all because of risk of infection. Well, I was so excited to get the Ellipsys because this will allow me to swim again. As far as the actual procedure, it was a couple visits. Dr. Bhanushali, he mapped out the veins. He showed me exactly what the procedure was. Once I found out that it was very inobtrusive and it was very quick as far as the surgical procedure is concerned, and that I'd be able to do everything I wanted to do, I was pretty much on board. After the procedure, I felt relatively good and it was not painful. And I was able to cook my own dinner and play with my dog. My experience at NANI with the NANI facility are doctors. The staff here is great. The procedure, they make everything very, very easy, very understandable. And if I had to do it all over again, I would.